Welcome into Body and Soul on 938 Live. Thanks for joining me. I'm Daniel Martin, and this is your daily health check. In today's edition, a stroke. That's a medical emergency, and it can have debilitating consequences. An especially worrisome aspect is that it can often occur very suddenly with no warning or sign. It's estimated that there are 9,500 new stroke patients a year in Singapore, and that number is set to continue to grow with our aging population and increasing lifestyle risk factors. You know, a recent study has found that a particular drug might have some great impact for stroke patients. What's unique about this drug is that it actually involves TCM herbs and extracts. We discover more today with my guest on the program, Associate Professor Christopher Chen from the Department of Pharmacology at the National University of Singapore. He was also principal investigator of the study that I mentioned. It's called the Chimes Study. If you have any concerns over stroke or this kind of approach utilizing TCM herbs and extracts, you can join in with any questions you have. 669-11938 is our studio hotline. Dr. Chen, welcome. Thank you for joining us. I want to start with a build-up of stroke and an understanding and an overview of that before we start talking about how this drug can potentially work. Let's talk about, the official definition of a stroke. What do we mean by when we say somebody's had a stroke?
Well, good morning, Daniel. Thank you very much for inviting me to come along. What do we mean by stroke? Well, there is a scientific definition, which I'm not sure of that much interest to your readers, but let's just say that the most common type of stroke is due to a blockage of a blood vessel supplying important things like oxygen and nutrients, like glucose, to the brain. Now, why is this important? The brain is the organ which uses up the most energy in the brain, in the body. And if the brain is starved of oxygen and nutrients, it doesn't function. So if you block a blood vessel, which is called an ischemic stroke, you have loss of function of the brain. And the loss of function depends on which part of the brain is affected, because unfortunately I have to say the brain is not just a black box. It is made up of various bits, and different parts of the brain do different things. So blockage of the blood vessels to the brain may cause symptoms such as weakness of the arms or legs, or paralysis of one side of the face, or sudden loss of speech, or sudden loss of vision, or sudden loss of sensation. So all these things can be symptoms of stroke.
I can see why so many people are fearful of a stroke. The outcomes can be life-changing in many ways. Are we right to be overly concerned about this? Are the rates high? Do we know whether stroke is a very prominent part of this part of the world?
Well, the statistics are impressive. Stroke in Singapore is already the third or fourth largest cause of death. But death, unfortunately, is not the only adverse outcome. Stroke is the largest cause of physical disability in adults, because many stroke victims, unfortunately, are left with permanent disabilities. Inability to walk, inability to look after themselves, inability to think or to speak. So it is a very important problem, and it's increasingly important because stroke increases with age. And I think, as most of your listeners know, we are an aging society.
Absolutely.
Stroke is also associated with vascular risk factors such as hypertension, diabetes, high lipids, and all these risk factors are unfortunately increasing in Singapore.
That is part of our forward trajectory. We're quite familiar with that. We know that as well. So that's why I do hope that we can pull something out of this in terms of hopefully understanding what we can do to prevent this from happening for ourselves altogether.
Exactly.
Who's at risk then?
Okay. We're all at risk. Okay. Stroke is not something which just affects the elderly. It's more common in the elderly. But the good news is that we've learned a lot about how to prevent stroke. And of course, prevention is much better than
treatment. Of course, yes.
Obviously. We know that lifestyle changes, such as stopping smoking, having a healthier lifestyle, diet, physical exercise, can all reduce your risk factors for stroke. And if you do have risk factors such as hypertension, diabetes, high lipids, treating these risk factors reduce your risk of stroke.
Okay.
And of course, one of the crucial issues we have is to identify how to incentivize all of us. I mean, I'm talking about all of us now because I'm equally as guilty of not taking as good a care of my health as I should.
As am I. As am I.
But we have to find ways of incentivizing all of us to keep to these healthy habits. Because I'm afraid that one of the problems with preventative medicine is that you may not appreciate that something didn't happen. Yeah.
Because you wouldn't know it would have happened.
That's right. And we all know stories about how one of our friends or our relatives smoked all their lives and they never had heart disease or a stroke.
Yeah, you always hear those, always.
Yeah, but you see, you can't generalize from that.
Yeah.
The fact of the matter is that these are risk factors, and if we can find ways of reducing these risk factors, we can prevent stroke. Now, that's if you haven't had a stroke. But if you've had a stroke, there are also now very good trials showing that there are many ways of preventing stroke after your first stroke.
From happening again.
Let's
pick up on that in just a moment. We'll continue on Body and Soul, and my guest, Associate Professor Christopher Chen from the Department of Pharmacology at the National University of Singapore and Principal Investigator of the Chimes Study. Body and Soul continues in just a moment.
Body and Soul.
Well, welcome back to Body and Soul on 938 Live. Dr. Chen, we were just talking about, what should happen in terms of treatment options, and there has been, of course, as you said, good advances in treatment approaches. There is a specific window of treatment that's very important for a stroke when it's happening. Tell us about this.
Thank you very much. Well, I think that this is why my colleagues and I have tried to emphasize that it's very important for patients and their relatives to recognize the first signs of stroke. Yeah. And I think there's a good public health program about that. And if you recognize the signs of stroke, we urge people to come to medical attention as soon as possible. Because what has been shown is that within a 3-hour time window, treatment with clot-busting drugs, in other words, drugs which can open up the blood vessels, are effective. That's number one. But even if you don't arrive in time, we have evidence to show that putting patients on what is called antiplatelet drugs, that is, drugs which prevent your blood from being so sticky, will reduce the risk of having more strokes. And admission into specialized stroke centers will give people the best chance of recovering after a stroke because it enables the doctors to identify what risk factors you have. For example, and this is not common in all patients. In some patients, they may have a blockage of what is called the carotid artery, the main artery that supplies the brain. And if that is the case, surgical treatment may be indicated. In some patients, it may be found that you have heart rhythm irregularities, and so a specific treatment with much stronger blood thinning agents is indicated. So all these things can be done. So I urge patients to come in early, be assessed, and there are appropriate treatments.
It sounds like all the treatments, the main goal of everything is to get that blood flowing to the brain as quickly as possible.
That's true. We are plumbers.
I've never heard it described that way, actually. That's a good way to describe it. Let's take a question from Albert, who has a question about stroke right now. Hi, Albert.
Hi there.
Hi, you're on the air. What's your question, sir?
Okay, I just want to know how bad it is, or how badly it is to have high hematocrit.
To have high?
Hematocrit.
Where did you hear that term for yourself? Did your doctor tell you about it?
Oh, it's just you have a very high red blood count in the body.
Yeah. So, has that been told? Are you worried about it for yourself? Have you been told that you have high?
Yeah. I've got about 52, 53%. Sometimes it goes a bit lower when I go to for vivisection and things like that.
Okay.
My worry is that because the blood is so thick, you see.
I understand. Thanks very much, Albert. What do you think, Dr. Chen? Is that an indicator? Are there indicators like this, your high red blood count cell?
Thanks, Albert. Well, one of the reasons why some people, are not saying it's you, have a high hematocrit is smoking. So, taking care of stopping smoking may reduce your hematocrit. Another reason why you may have high hematocrit is that you have a blood disorder. And I think appropriate treatment for that blood disorder may be indicated. So it sounds as if you're already getting regular treatment with vivisection. So I think that's the best approach. Having a high hematocrit is not very common in our stroke patients, but it's one of the causes of stroke.
It can be one of the causes.
It can be.
Okay, Albert, thank you, and we're glad to hear that you are seeking treatment for this as well. Thanks for raising that concern. Dr. Chen, I beg your pardon, we are talking as well about the treatment post-stroke.
Yep.
Does it have to be in the realm of treating the outcomes, really, of the stroke?
Sure. I think that the outcomes after a stroke are dependent on several factors. Firstly, of course, how bad your stroke was. Secondly, it depends on the patient themselves. If the patient has many comorbidities, I'm sorry, that's a large technical term to go and say, do you have other illnesses? You might not do as well as somebody who has fewer illnesses.
Yeah.
Okay. And of course, a part of the stroke recovery depends on the patient's support. Good family support, good social support is very important for stroke recovery. We have rehabilitation to help our patients maximize their recovery, but what is really lacking, and which is why we've done the study that we're going to talk about later, is that there are no established drug treatments for improving stroke recovery after a stroke.
Is that right? So, I mean, is there a high likelihood that someone who's had a stroke once will have a stroke again?
Yes, that's different. That's preventing a next stroke. What we're talking about is, are there treatments which can improve your brain function after you've had a stroke?
Okay, so this idea of plasticity?
Correct.
We want to talk more about that and learn about what that means. If you want to find out more, stay tuned. In the next segment, we'll talk about the study that Dr. Chen was the principal investigator of, the Chimes Study, which was a partnership of stroke experts. It was published in the Stroke Journal. And what was unique is the utilization of a particular drug that was a combination of TCM herbs and extracts as part of what you heard Dr. Chen describe, improving outcomes in the post-stroke period. We'll find out more when Body and Soul continues just ahead. Welcome back to Body and Soul on 938 Live with me, Daniel Martin. I know you want to know more about that particular drug that I was describing to you and its potential impact on stroke outcomes. It's an opportunity now to speak with the man who is the principal investigator of the Chimes Study. It's an international partnership of stroke experts. The study was published in Stroke Journal, and what's unique is what the thing that was actually explored, the drug in question, was a blend of TCM herbs and animal extracts, and it could have an impact on outcomes post-stroke for patients. What do we mean by that? Let's find out more with Associate Professor Christopher Chen from the Department of Pharmacology at the National University of Singapore. Dr. Chen, I teased in the beginning of my interview and in previous days as well that this is a blending of TCM and Western medicine, so to speak. To me, that's because we're exploring TCM herbs and extracts and a combination of it, but using the rigor of the Western methodology. How important is this in terms of the modern drug industry that has to go through this rigorous process?
Well, the modern drug industry is always looking for new treatments which are safe and potentially can have a beneficial effect. So traditionally, pharmacology has always looked for these treatments in what we call small molecules or biologicals, etc. But I think that there's no reason to discard the knowledge which has been gained from other fields, such as traditional Chinese medicine, because in this case, what happened was that this particular compound was identified by our colleagues in China as being useful for stroke. And what we did was to examine it with Western methods. We used it in standard pharmacological models, and we could show that it had some very interesting properties. It could reduce stroke damage in animal models of stroke. It could be shown in animal models that it increased the number of new brain cells, and it also increased the number of connections between these brain cells. And all these things are processes which underlie this potential stroke recovery process called neuroplasticity. It's a fancy term to just describe how the undamaged parts of the brain make new connections and therefore restore function of the brain.
Why is this so important? Would it normally happen on its own naturally in a post-stroke patient or not?
Yes, neuroplasticity is a natural process. It may be enhanced with our standard rehab therapy, but what we wanted was a way of increasing this neuroplasticity so that more patients could benefit and maximize their recovery after stroke.
translate that to the lived reality of the person. If we can create new pathways, if we can increase that rate of neuroplasticity, what does that mean for the post-stroke patient?
Well, what we hope for patients is that they recover as much function as they can so they can be as independent as possible in their lives. So just to give you an example, we use in our trial something called the modified Rankin scale. It's a very simple scale. It goes from 0 to 6. 0 means you have absolutely no problems at all. 6 unfortunately means you're dead. Okay, and what we're aiming for is for people to have scores of 0 or 1, which means they have very mild symptoms, or scores of 2 to 3, which means that although you have symptoms, you're still independent. What we don't want is for people to have higher scores that they are dependent on others or they are bedridden, which are scores of 4 or 5. So that's what we're trying to do. We're trying to shift people from bad scores to better scores so that they have a better quality of life.
What do we see in terms of the capacity for this drug to do that? Is it very high efficacy?
Well, first thing to say is that we have had no proven drug treatments for improving recovery after stroke. As I said, we have good treatments to prevent another stroke.
Nothing exists of that nature.
Nothing. So what we're doing is something quite unique. Okay, the trial that we did, and I have to say that, principal investigator is a very grand term.
Yes.
It just means I'm first among equals.
Okay.
And this trial would not have been possible without all my colleagues in Singapore, in the Philippines, in Thailand, in Hong Kong, and Malaysia, who all got together and decided that this was a trial worth doing, and they would make the effort to get the trial approved in their various countries and hospitals, and to put in the patients and to follow them. And of course, this trial is not possible without the patients and their families.
Absolutely.
I'm very grateful that people participated. And we couldn't do the trial as well without financial support from the National Medical Research Council of Singapore, and the very excellent support from something called the Singapore Clinical Research Institute. These are unsung heroes. I'm sure your listeners may not have heard of them, but these are the people who make trials possible because they help us follow up on all the subjects.
Okay.
Yeah.
But Dr. Chen, how efficacious was it in the study? I mean, what rates, what statistics do we see?
Sure. So the paper that we published, the results are published in Stroke, which is the premier journal for stroke in the world. And what we showed was that there was a non-statistically significant trend towards an improvement with this therapy. Importantly, we also showed that there were no safety concerns. So this is a safe treatment in acute stroke. Again, I should step back and say that the trial we did was in acute stroke. In other words, patients within 72 hours of their stroke. Previous studies using this drug, this compound, have been performed on patients with chronic stroke within 2 weeks to 6 months after the stroke, which showed some degree of efficacy. But we were very interested to see whether early on there was benefit. And what we showed was there was a trend towards benefit. It's not a proven benefit, but it's promising. Also, we found that certain groups of patients appeared to benefit more. And most importantly, we found that patients who were given this treatment later on, in other words, between 48 to 72 hours, appeared to do better than people who were given the drug earlier.
How much more? Can we quantify it? Was it 10% more, 20% more?
Well, it's difficult to describe it, but I'd say that it's a difference between odds ratio of 1.38 and odds ratio of 1.09. Okay, so that gives us some signal that perhaps this group would do better.
I want to take a question from Deborah, who's called through. Hi, Deborah.
Morning.
Hi, what's your question?
Good question. Then, since there's such a treatment, is it for normal people also can consider helping themselves to prevent stroke? And does vitamin B help in all these neuro
plasticity that we've been talking about? Can this be held in a preventative option, or is it purely for post-stroke patients, Dr. Chen?
We only tested it in post-stroke patients, so I really cannot give you an answer as to whether it's beneficial for people who have not had a stroke. I would think that the chances of that are not very high because we're treating pathology, and if you don't have pathology, it doesn't make any sense why it should benefit you.
I understand. Any indication of vitamin B in your own research by any chance, since she asked it, whether vitamin B is helpful in preventing stroke?
That's a very good question. It was addressed in a very large trial that we took part in called the Vitatops trial. And again, the results were published in a prestigious journal called Lancet Neurology about 3 years ago. And the results show that if you had a stroke and you were treated with B vitamins, your chances of having another stroke or heart attack were again non-statistically significantly reduced. But it was very close to significance. So again, it's not proven that B vitamins are beneficial after stroke, but it looks promising.
Thank you for your question, Deborah. I hope that answers it for you. We'll be right back on Body and Soul. Stay with us. Our final segment of Body and Soul on 938 Live. The Chimes study was an international partnership of stroke experts. The results were published in the journal Stroke, and it was seeking to explore whether this combination of TCM herbs and extracts in a particular drug could help outcomes for post-stroke patients. Dr. Christopher Chen joins us from the Department of Pharmacology at NUS, where he's the principal investigator of the Chimes study for this particular publication. What kinds of TCM herbs and extracts are we talking about? I mean, you said that these were identified by a team in China, actually. Mm-hmm. How can we best describe this combination of herbs and extracts?
Well, there were 9 herbs and 5 animal compounds. I think the main activity comes from the herbs. The animal compounds are usually there to go and make sure that the herb extracts don't collapse, so they are a presentable form. So the herbs, they're very complicated scientific names.
Yeah, you were telling me.
Yes, but I think that the major component is a Chinese herb called danshen.
Okay, so that's something that's quite familiar to some people.
They may be familiar to people. But let's go back to the results, if I may. I think that your listeners should understand that when we say statistically significant or not statistically significant, it's because we are trying to be very rigorous in how we analyze a trial. I think the main achievement of Chimes is that we actually got this trial done. Because there are many skeptics who believe that there's no need to do trials on traditional Chinese medicine. It's pointless.
Yeah.
But we've done the trial and we've shown that it's safe and that there may be efficacy. So I think the real next step is to consider whether we should do a larger trial. Why do these large trials? And the truth of the matter is that in medicine, most of the effects that we are looking for are relatively small, but may have important clinical and public health effects. For example, there is no need to do a trial on parachutes. And you need very small numbers to show that parachutes are important. But for most medical trials, you need large numbers. To give you an example, to show that aspirin was beneficial in stroke took 20,000 people.
Wow.
To show that clotbusters were important for heart attacks took many thousands of patients. So we're at the first and important step. We've taken the first step, and I hope that we can take other steps with the support of the research councils to do the trials which are necessary to prove whether this treatment is efficacious. Should we give it for longer? Should we give it to selected groups of patients?
Absolutely. I look forward to seeing whether that can happen as well. Best of luck with that. Dr. Chen, thank you for your time today. And if you want to find out more about this, you can look for the Chimes study. It's spelled CHIMES, where Dr. Christopher Chen was the principal investigator of. That does it for today's edition of Body and Soul right here on 938 Live. Thanks for joining me, Daniel Martin.